Hi, namaste. We're meeting after a long time, but as you say, der I durust I. So I'm back, and I hope you all are doing good and keeping yourself safe. I just want to convey that it's the kind of love and affection which is pouring out with these videos is really kind of giving a lot of encouragement to go ahead with lots of topics. And इसी के साथ I would say that the topics which we had been talking about was HIV, and recently we started correlating it with COVID. And with all those questions which you're putting across, a few questions I would like to take up in today's session, and two such questions which really uh, made me think that yes, we need to discuss, and maybe a little bit of clarity will be a good initiative. So one of the questions which came from the viewer had been on prevention. So they wanted to understand that how can we prevent ourselves from HIV and also from COVID, which is currently the current pandemic situation in the entire world. Now, with HIV, what I can say is, the most important thing which can prevent us is the condom. Using condoms properly will prevent you not only from HIV but from also other STIs and also unwanted pregnancies. So condom is a must. Along with that, the other preventive which has measure which has come up recently in the last couple of years, and which is being advocated throughout the world, including in India. In India, it is in the private sector, not in the public sector, and that is the usage of pre-exposure prophylaxis, or in shortcut we call it as PrEP. Now, PrEP is getting advocated around the world. You must be, getting to hear about this terminology quite often in the medical journals or in the discussions where HIV is talked about. And the same is getting pushed in the private sector. We are expecting that maybe in the longer run, the government will take up. But what PrEP does is that PrEP is just an ART medicine, that is the antiretroviral treatment, which we have to pop in, and that will prevent us from acquiring HIV. But it is not 100%. The studies do not say it's 100%. The statistics talks about 98, 99, but it is never 100% safe. But still, I will not get into the technicality of how PrEP is being used, because it's if somebody really feels that he or she is indulging into high risk activity where the person is getting exposed to HIV, in spite of being informed and being told that please prevent yourself, and also if the individual feels that mujhe use nahi karna, I don't want to use a condom. There are few people who talks about that, in spite of repeated counseling has been done. So in such a situation, PrEP is very useful, but still I would say PrEP is pretty costly. You have to pay for it. It's not something like you take one tablet today and you just knock it off. You don't take it for the remaining days. It has to be taken continuously till the time you're getting exposed, or you're into this activity where you are getting yourself exposed. So that is there. But the sasta, tikau and effective measure is using of condom. So use condom, and you don't have to deal with all these medical things which will go into your body, and your system is going to grasp those medicines, and the side effects which might turn up in a longer run. Means you need to think about that you're popping up medicine, so you have to think about all those pros and cons. So this was there. And with this, the prevention about COVID. So COVID, we all know that one injection, second injection, so 2 jabs of vaccine is very important. That is how we can prevent ourselves. उसी के साथ along with that, we are also in a need of wearing mask. Wearing the mask is very important. It should be covering your entire, nostril and the mouth. It should not be like this, or it should not be like this. It should not be like, going like this. No, it should be properly put around your face so that you can prevent yourself from getting exposed to the virus. And along with that, the social distancing. So many people don't understand that until unless you don't keep yourself a little bit, aside or apart from unknown gatherings, uh, it's going to be a little bit troublesome because you are getting exposed. You are in a surrounding where the virus can be there and it will have more accessibility into your system rather than being in a place which is a little bit, quieter, where less people are there. No, but not much of crowded people around. So that is one thing. So these are the three important things which we have to understand. And washing our hands properly, sanitizing it is also a must. These are preventive measures for COVID. Now, along with this, the second important question which came was behavior change. How can we change the behavior of people who are prone to get HIV or who are prone to acquire coronavirus? So for a behavior change in HIV, if I have to mention, it is to abstain yourself from having sex with unknown people whom you don't know at all, or abstain yourself indulging into any other activities wherein you're not in your senses, and for an example, indulging into drugs, injecting drugs. You have to make yourself strong enough that these temptations should not lead to such a remorse act which you will regret. So that is one thing. Along with that, sex with alcohol should not be mixed because you never know what is going to happen after that. Be careful when you're meeting strangers, especially for women, that don't take drinks in a bar or in a pub because you don't know what is there. Even a glass of water should be avoided. You just be polite, say, "Oh, thank you so much. I'll have my own self. I can take care of myself. So thank you," but very politely. So these are certain things which we have to be careful of. And along with that, for COVID, the important thing for behavior change, how would you change the behavior of people? So you can see that still people are not, they're reluctant. They don't want to grasp the understanding of being away from the crowded places, or to have these vaccinations done. So this is what proper awareness. Talk about it, okay? Especially those individuals who are a bit reluctant, who do not want to take up the signs. Speak to them, counsel them, make them understand they should have, eat healthy food to keep their immunity boosted. They should also have regular exercise or whatever they want. If they want to have yoga, you want to have a walk around the places, the parks, that should be there. And another important part is the mental health. So mental health, taking care of it is very important in this COVID, so that you do not get carried away with miscommunication or with information which talks against your existence in this COVID situation. So these are the ways where you can change your behavior, you can change people's behavior and make them understand that no, as strong as we are, we will be always together. So that's all. So signing off, take care, and Shabba khair, and I'll see you next time with other sets of questions. So we are waiting for your questions. Yeah, take care. Bye.